Can you see my screen? Perfect. Well, thank you everybody for joining us tonight. It's 7:01, so we'll get started. I know a lot of people will still be joining us throughout the call, but we'd like to welcome you all to our last webinar of the year, which is all about future-proofing your MedTech career. So we're really lucky to have 4 great guest speakers sharing their insights from industry with us. I'll just quickly introduce GenMed for those of you who haven't met us before, and then I'll just go through a little bit in terms of this being a Zoom meeting format. So I'll just explain a little bit about that and then the format of the night. So welcome to GenMed. I'm Tara, one of the co-directors of GenMed. We're a specialist recruitment agency specializing in the MedTech or med device and pharmaceutical areas, as well as specializing in recruitment. We're really passionate about education and giving back to this space too. Hence, we run GenMed Academy, which is a professional development training platform for people in the industry. And that includes events like tonight, where we're lucky to be joined by people from industry with lots of knowledge. So if I can ask, unless we're getting to the point of asking questions and I open up the floor, please keep your self on mute and follow polite Zoom etiquette, so no taking your laptop to the bathroom or anything with you on the breaks. And please know that this webinar is being recorded and will be shared with our GenMed community. And then along the way, you can write questions into the chat box, or when I prompt you to ask questions, we can take it in turns to unmute and ask questions to the guest speakers. So a little bit about us, you might see some of these faces on the screen tonight. So here's some of the team, but just a little bit about who we all look after. So Casey and myself set the business up pre-COVID, and I specialize more on the client side and really helping our clients find solutions for their hiring needs and executive search. Casey specializes in senior MedTech recruitment. Eleni, who's on the screen somewhere, specializes in our GenMed Academy rookie programs, so helping people that want to be recruited into the MedTech and pharma spaces. We've got Soph, who's diligently working in the background here, who does a lot of recruitment in ops and loan kits and customer service positions. And then Tanya and Gemma, who you might see on the screen, help us from an operations, administration and marketing standpoint. You'll see some friendly faces. GenMed Academy, for those of you who don't know, is an online professional development bootcamp. When Casey and I were both in the industry, we found that training and education very specific to our industry was sometimes lacking. And so we're really passionate about giving back and finding resources to help you grow and develop in your career. And like I said, some of those resources are webinars like tonight that will then create as mini courses and key takeaways for you on GenMed Academy. So we'll follow up with an email sharing more for you about that. And the other part of GenMed Academy is our rookie programs. We have our professional medical device rep program and our pathway to pharma program that Eleni now manages. So just as some interesting stats for you, we pulled some recently, and over 114 candidates have completed the professional medical device rep course within the last 18 months. And 49 of these people have been placed in a role within the medical device industry over the last 18 months. And are all still in those positions across 25 companies. So we're really proud of the retention rate of the people going through our academy programs, but also we're really proud of the numbers of people that don't choose to come into the industry, because once they do our courses, which are very honest about what our role involves, they actually self-select out, or we might choose that they're not right for the industry in that process. So we've all been there. We've all hired people that look brilliant on paper, interviewed really well, and then actually didn't really understand what our interesting and nuanced jobs involve, and it just wasn't right for them. So we're continuing to invest in this future pipeline of talent for our industry. So today, why future-proof your MedTech career? Well, again, we come from a background of MedTech ourselves. So both Casey and I worked in national sales and marketing positions. We actually both transitioned from allied health ourselves, and both of us along that career journey didn't feel like we had lots of advice in terms of how to really strategically map out your career and how to make sure that the moves that you were making really aligned with the long-term vision. And we're all about making partnerships between our candidates and our clients that are long-term, or help our candidates with that long-term vision, or again, we're really making sure that we're making matches in terms of aligning values and goals. So we're really lucky to have 4 people here with us today. So Charlotte Taylor, who will be talking about challenges, tips and tricks to progress from moving from territory management into people management. So I know there's a lot of people on this call that will be looking to move in that direction over the next 12 to 24 months. We have Will Downey, who's going to talk about a different area, hot topic, which is digital literacy and other skills that sales professionals should be looking to develop in an evolving market that isn't your kind of typical specific sales approach. Kimberly Russell, who's joining us to talk about taking an educated leap into a different product portfolio. And I know that's a conversation we have a lot with candidates who are intrigued and or nervous to do this. And then Jared Hanna, who's kindly offered to talk about how to make yourself really stand out in the crowd as you're moving into the more managerial positions and making yourself highly hireable and desirable in leadership. So we'll start today with Charlotte. So thank you, Charlotte, for joining us today. You can unmute your mic. Charlotte is Regional Sales Manager in Queensland for Stryker. Like myself, you started your career as a physiotherapist before moving into sales into the industry. And you've worked your way from being an associate territory manager through to being a regional sales manager in the industry. So we're really excited to hear your journey and some tips and tricks that you can share with our community. So I'll just stop my share and we'll share your presentation.
Wonderful. Thank you so much, Tara. Yeah, and big thank you really for having me here tonight. As you mentioned, I'm Charlotte Taylor, so I'm a regional sales manager at Stryker. Basically tonight, really what I wanted to do was run you through my career, share some stories along the way, I guess just so that, you know, people can see some of the challenges and learnings that I've had along my journey. So Tara, I might just get you to just change the slide. Wonderful. So as Tara mentioned, I come from a background of physiotherapy. So I graduated from UQ and I worked as a private practice physio for just under 3 years. So I loved being a physio. I loved the relationships that I built with my patients and that initial challenge of managing those musculoskeletal injuries. But like many physios, I did feel a bit underwhelmed with my career. I felt like I'd reached a bit of a ceiling with my earning capacity. And I also felt like most days I was no longer challenged. I'd always been so intrigued by the MedTech world, and I spent my final year as a physio trying to break into the world of medical devices. So despite applying for countless roles, Stryker were actually the only company that took a chance on me and responded to my application. They took a chance by offering me an associate territory manager position within joint replacement. And I remember very naively being so disappointed that they didn't offer me a territory manager role straight off the bat. But needless to say, within that first week of starting, my disappointment was replaced with relief. I really had no idea how much I didn't know. So that first year in the role, I think I said yes to every opportunity. I was dying to get better. So any add-on case that came up, I put my hand up for. Any sales opportunity I came along to. I made lots of mistakes and I spent the majority of my day outside of my comfort zone and I truly loved it. So just the next slide, please, Tara. So a bit over a year into being an associate territory manager, the Gold Coast territory was split and I applied for that TM role, managing the South Territory. I was successful. It was a big jump for me at that point. Whilst I'd had a year of clinical experience under my belt and I could finally add value in theatre, I had not yet had the chance to really have that responsibility of a sales number. I didn't know the customers on the Gold Coast, and I also had to win the respect of my clinical team, who were at the time far my senior in tenure and in that knowledge piece as well. I remember thinking, how do I add value to my team? How do I get them to trust me? And will they ever look to me as a leader, which is what the expectation was of a territory manager? in joint replacement. So over the next 3 years, we did see significant growth within this territory, both in sales and with the size of the team to service that business. The number of clinicals in the patch doubled, and the dollar value of the territory increased by over 50% within that period. So for me, there were some big challenges I had to overcome and a lot of learning that took place. I worked extremely hard to win the trust of my customers and to execute my business plan. I knew what I was doing was getting traction, but with this, I became fiercely protective of my business, and I found that I was often spiraling into periods of insanely long hours and burnout. I found it really hard to trust other people in my team to look after the customers the same way I did. But ultimately, I could only be in one place at a time, and if I really wanted that business to continue to grow and to have a bit of a work-life balance, I needed to trust other people and bring my team along that journey with me. So at that point, I really started to invest more time in the team. I got to know their strengths and what motivated them. So here at Striker, we utilize a framework called Clifton Strengths to look at what people are exceptionally talented in. I spent a lot of time with my HR business partner to try and uncover ways of better working with the team. I also invested a lot of time in the team to really understand what motivated and drove them most about the role. I didn't always get it right. In fact, quite often I did get it wrong, but I always learned from those situations. And to my delight, those in the team seemed to like having their own responsibilities and projects, and we became more productive as a group. At this point, I really started to realize how rewarding it was seeing other people being able to use their skills and work towards a common goal. And with this came mutual respect. So just the next slide, if that's all right, Tara. Thank you. So given the success the team had and how closely the two Gold Coast territories worked together, the business made a decision and we merged the Gold Coast territories into one big one. At this point, that territory was bigger in dollar value than some of the states in the business. It was a team of 8 and I was promoted into a business territory manager position. So for anyone that doesn't know, that particular role is a role that Striker has created to encourage the development of leadership skills. So essentially you have the same responsibilities that a TM would have, but with a far greater expectation around that leadership piece. So you truly manage the day-to-day of the business with a relatively large team. And really the role was created given the success the business had seen with robotics and to ensure that exceptional salespeople were able to partner with their clinical team to continue to grow business. The role enables salespeople to truly develop leadership skills to become sales managers, or you basically just get recognized for being really successful in that role and being a leader day to day if you decide that that's not the path that you necessarily want to go down. I loved this role, but again, it did come with challenges. And I'd say my biggest challenge was influencing without authority. How were other people perceiving me? Was I really respected? Sometimes I felt I got this right and I was influencing and getting the team's respect. And other times I felt I didn't back myself enough when things got difficult and I let things go. I'd say one of my biggest learnings in this role was the importance of setting expectations. And this has helped me in so many aspects of my life. I think it's really important to set expectations as a colleague, as a manager, but even someone being managed. I truly believe that clear communication is what sets other people around you up for success. I built trust and respect by working out what I could bring to the group that otherwise other people couldn't bring. And we also made sure we had a lot of fun. So it was a really great group. There was a lot of banter. And I think having fun was also another reason why we were happy and successful. This was also the first role I've had in sales where I had to decide on what opportunities not to chase. So I'm sure the salespeople on this call can understand how difficult that is. I learned how important it was for strategy and business planning to be really, really simple. And I made my focus in the role communicating the business plan to the rest of the team, making sure they knew what part they played in it. Also me executing my part. But I guess the other big part was actually celebrating the wins that we got together. Just the next slide, please, Tara. So this year was my first official year in a sales manager position. And whilst I've been doing aspects of this role for years, this new position was again, further challenges. It was one thing to influence without authority, but another to truly be given that responsibility of having direct reports. It was also difficult going from a colleague and friend to a manager, especially when some people in the group, again, had far more tenure than me. I also moved into a management group where I'd actually been previously managed by some people within that group. So there was also that challenge of me trying to gain some of the respect of my new peers. This year was also the first year I've had a P&L. So opening that Excel spreadsheet for the first time for me was like reading another language. I reached out to our finance analyst and requested some help understanding it. And I was actually delighted to learn she was new in her role too, because I felt pretty silly at that point. And while she's very, very experienced in finance, she actually didn't know the JR business very well at all. So straight away, we were able to realize how much we could help each other. And to this day, we still do monthly catch-ups and still help each other, which is really great. I've also realized how important it is to back myself and not let insecurities or feelings of imposter syndrome drive the decisions that I make. Earlier this year in a mentor meeting, I remember questioning some of the decisions I'd made for the business. My gut feeling was telling me that I was spot on with the decisions that I'd made, but I was still doubting myself. The mentor I was speaking to challenged me and asked me why, after so many years of being a leader within the business, why I did that. And it actually really gave me the strength to realize that that's really just an insecurity. And, I do have the skills and I was put in this role for a reason. So anytime now I have that doubt, I remind myself of that conversation and, essentially why I'm here. But by far the hardest part of this role, I think for me, has been making those decisions that are best for the business, knowing the huge impact that it has on the people that I genuinely care about. So, some of these people have been in my team since right at the beginning. And overall, it's been incredibly rewarding seeing the team develop and, and achieve some really incredible things. Just a final slide, please, Tara. So really, for anyone in sales that's considering people management roles, my advice to you would be, number one, invest time in developing those skills. I think there are so many excellent leadership books and podcasts out there. Block out weekly time for self-reflection. I think this has been probably the most valuable thing I've done for my own development. And I truly believe that if you don't take the time to critically self-analyze, you're actually not going to grow in any aspect of your life. Secondly, I would say to use the network around you. So I really believe that, Striker, the best bit about it is the people, but more broadly, the MedTech industry does attract some pretty incredible people. So I think network and always be respectful and courteous of your competitors. You never know what you're going to learn from people around you and what having people on side will do for you. Thirdly, I think you really need to understand what your company can provide you in terms of development. Partner with your HR team, proactively seek out talent programs. And again, my experience is Striker, and I know we do an excellent job of our talent programs. But I think if you reach out to other people within the business, you will be able to get some of that direction that you're after. And my final piece of advice is to get a mentor. If you don't have a formal program at work, proactively seek someone out. And also be a mentor. Put your hand up for a buddy program, reach out to a new starter, and make them feel really welcome and supported. Thank you.
Thank you so much, Charlotte. I've lost you now on my screen. Oh, there you are. First of all, thank you for being so honest and humble to talk about the real challenges that happen, things like, building that or letting go and the trust factor when you're letting go from moving from your own repping and having your own state to working with other people and handing some of those tasks on. And then, a few others that you shared, and then some really actionable takeaway steps for people. So I know no one likes to be the first person to ask questions, but while you've got somebody on the line that has actually recently made this move, does anybody have any questions there? I think I just saw, is that Chris? Did you just put your hand up? Yeah, you can unmute, Chris. And
No, it's just clapping my hands.
Oh, that's nice.
Thank you, Chris.
Any questions for Charlotte? There will be an opportunity at the end as well, but does anyone have any in the meantime, or you can always put them in the chat if you're shy to talk? No? Okay, well, what we might do, we might move on and then we can always come back to questions right at the end. That's okay, Charlotte?
Yeah,
Oh, Liam has a question, I think. Yeah, hey, Liam. You can unmute.
Hey, sorry, excuse me. Can you hear me?
Yeah.
We can hear you.
Thank you. So thank you for sharing that. That was some great insights there. Try to write down as much as I possibly could. I come from a physio space as well, selling physio products originally. My job that I've just landed now, it's a bit of a dream job, is selling CT machines, so a type of CT scanners, specifically for cone beam. But you mentioned that use your networks around you as much as you possibly can. Coming from that physio background and, you know, going from a different market, you know, dealing with more surgeons now, dealing with more radiologists, how do you suggest that I could, I guess, use my network around me?
Yeah, it's a really good question. And I think if I'm going to answer really honestly, I think you need to build your network. So, you know, you've come into a really new space and like you're doing the right thing, getting on a call like this already, you're building that network. But, you know, every time you're in a tea room, you know, who else is in there? You know, you might meet another rep that has, you know, similar goals and whatever to you. And then your surgeons, you know, once you really build a relationship with them, they're going to be your biggest advocates. If you need relationships, you know, I often ask my surgeons to introduce me to other people, and I know they'll always do that. So yeah, I think you really need to start just building it. And you know what it's like, once you start the initial part, it just gets easier and easier. So
Yeah, thank you.
Good
Awesome.
question though, Liam.
Thank you.
Thank you, Liam. Does anybody else have any questions? Okay, I don't.
A quick question, if that's okay, Tara.
Yes. Hey, Justin.
Hi, how are you?
Good, thank you.
Hi, Charlotte, how are you?
Hey, Justin, I did think that was you. How are you?
Great, thank you. That's fantastic. Thank you for sharing. Just one quick question. Like, I think we'll help everybody as well. You're obviously an incredibly successful territory manager and territory business manager. What was it that made you want to make the move from, you know, being that really successful individual contributor to going into being, you know, a super successful regional manager as well?
It's a good question. There's two sides to that. So I guess the first part is, I guess, the kick that you get from seeing other people achieve. So that was really important to me. And I guess the other thing that I probably want to call out as well, I love sales. I feel like I'm a salesperson through and through. So it was really hard for me to step away kind of into more of a leadership role. But I guess really the thing that probably tipped me over maybe sooner than it kind of otherwise would have happened was actually starting a family. So I've got a little girl who's 2 and I am actually pregnant at the moment. So I'm halfway through with our second one, which is really exciting. But I just found being pregnant at 11 o'clock at night in theatre was not really sustainable. And for me, I just needed something that gave me a little bit more balance and a little bit more structure, which, you know, I think we have to call out that TM role. It's not that. So that probably would have been that other piece as well for me. Yeah.
Awesome. Thanks for sharing. Congratulations again.
Thank you, Charlotte. That's super honest. And I think, you know, you've obviously done a lot to develop yourself into that leadership position, but people do think about that and it is challenging for people. So knowing that that's a pathway that can help people, that's good to know.
I have a quick question, if that's okay.
Yeah. Hey, Eleni.
Hi. Charlotte, that was a lot of great information. One thing that I know comes up quite a bit from people wanting to make that transition is, were you identified as talent for leadership and then invested in? Did you put your hand up and interview for these roles in order to continue to succeed and get those roles?
Yeah, that's a really good question too. So again, I know I mentioned before, I'm a salesperson. I definitely am. So for me, I knew that was the path I wanted to go down. So I kind of considered it like a sales call. I had to work out who are the stakeholders that are going to make the decision, and I needed them on side. So it was, very deliberate, the relationships that I made. And I was very conscious of, how those people perceived me. And again, I was vocal about it. But I think you've got to be careful with that as well, because you don't want to be so vocal that you're the annoying person asking for a promotion all the time. You kind of have to earn that as well. But yeah, that was probably the steps that I took. So really understanding who made the decision, understanding the way the business was going. So is there a business need for it? And essentially, what are they looking for? And making sure that I had those skills. So when a role came up, I was the obvious candidate. Yeah.
Great, thank you.
Excellent. Thank you, Charlotte. Any more questions at this stage for Charlotte? Okay. All right. Well, I might move on to our next guest speaker, and then we can always come back and ask some questions at the end. Thank you very much, Charlotte, for sharing your insights.
Brilliant. So first and foremost, thank you, Charlotte, for that. That was brilliant. So I'll wait for Tara to give me the point to share my screen, and we'll get cracking.
Oh, yeah, just give me 1 second. Sorry. So I'll just introduce you there, Will. So we'll come through a background in occupational therapy. So Same made the transition from allied health. And you've worked at J&J for 10 years now in the UK. Obviously, we can hear from the accent, and Australia. And really, again, started at that initial trainee territory manager position to now being a customer solutions partner. So I think people will be quite intrigued about your role and responsibility. So thank you for joining us, Will.
Brilliant. So I'll just double check that everyone can see my slides.
Yeah, just pop. There we go. That's perfect. Thank you.
Brilliant. So look, for me, I guess my journey is kind of strange. So I don't want to focus too much on that, but I certainly started out as a trainee territory manager, worked as a rep through that, did a bit of sales management, and then ended back up in the weird, wacky world of solutions and technology, where I guess I came from a very untypical background, and learned a lot in terms of, I guess, learning new skills, the critical importance of the teams that I manage, the teams that I work with, and the diverse thinking that comes with that, and essentially the importance of evolving our conversation, not just for us as industry, but also to our customers. So I'll go on a little bit about that. So firstly, about J&J. Look, I'm obviously, you've heard from Stryker. I'm obviously going to say that J&J is a great place to work as well. For us, as a great place to work, we're certified. 90% of people in J&J believe that it's a great place to work, versus sort of 56% of a typical Australian company. And more importantly, when I talk about the diversity piece around being, I guess, a WGEA employee of choice for gender equality, and that's really important for us, as it is actually a lot of MedTech companies. And diverse thinking in itself, from just looking at gender in different ways, those are the companies that are going to win, right? And actually, my ask to you guys is actually really embrace that, learn from the different people around you, because that is stuff that really makes a difference. And Charlotte mentioned a little bit about jumping out of your comfort zone, and tech, right? We're medical device reps. That's scary, but when you think about it and you break it back down, actually, it's not quite as scary as we think it is. It's about taking a jump and really understanding what we're trying to look at. So look, why is that important? So when people talk about tech, we often think, oh my goodness, it's going to be everyone coding in a room, and that's what tech is. The reality of that is, it isn't that. if I just look at sort of the little graphic on the side, there are people working in digital search. You look at digital search teams that support our doctors as we go. Communication, digital comms, that's another area in medical devices. The actual creative side, which is some of the stuff that I've done in terms of development and building apps and capabilities, but also the critical thinkers and practical and functional skills. Now, all of those different areas are important, right? And I would think if you look at all of those 5 things there, I guarantee you, every single one of you will have the ability to do a couple of those, at least. And while healthcare is evolving, we've got to evolve too, right? We've got to get more comfortable with this stuff. But isn't that a fantastic opportunity? Now, if you look at, I guess, the little graphic in terms of, you know, the different people that are all looking at the same 8 wave, infinity, whatever you call it, that is 8 different ways to solve a problem. So if I had 8 people who are in this room today, looked at the same problem and they didn't speak to one another, I bet you get 8 different answers. And what an opportunity to find ways to understand how to solve problems. And I guess this is one of my big things, and I'm a big believer in understanding, you know, what's so important about people's differences. Would you want 8 superstars on the same team? Instantly, you'd think absolutely yes, but I wouldn't. I would want 8 very different people. And if I look at certainly the sales teams that I've worked with and managed, who have been successful, and they were brilliant, they had completely different ways of doing things. And for me, it's about harnessing that and actually learning to show your differences. You know, we talk about digital literacy all the time, right? And we say, well, that's scary. If you look at, I look at, say, back when I was selling sutures, I was pretty comfortable there, to be honest. It was great. I had a lot of opportunity, winning awards and stuff there, but I didn't know the granularity you could go about learning different stitches, or the difference between orthopedic implants. It's crazy. So I guess when we break it down to that granular level, digital literacy, is that actually that different to when you started learning about the medical device industry, or the complexity about what you thought was, say, a very simple product? I bet for the people who are speaking today, you could take the granular differences between different implant companies have got different things, and that actually in itself is incredibly powerful. But when you think about that from a customer standpoint, and we go back to that point on digital literacy, it's scary for them, right? We've already talked about robotics in surgery. What's the AI? What's the digital piece that's coming with that? Imagine you're a surgeon and you've done things the same way for 10 years, and all of a sudden the technology's evolved. There's a demand for robotics. There's a demand to digitally talk to your customers. It's new for them as well. And the role of, I guess, sales reps and the opportunities there is actually, how can you support and humanize that process for your customers as well? So I guess I've said a little bit about my journey, which was kind of a bit crazy. I think if I look at the teams that I worked in when I was a sales rep, I was always working with problem solvers. And that was the best thing about my job. Different ways of solving problems, enjoying solving the problems in themselves. But also on top of that, I think I look at when I was a TTM and I was learning products, and then I became that sales specialist and managed salespeople. I chose everything based on the experiences and the opportunities to learn. And one of, I guess, the least constructive things I'm going to tell you on this call today is, I actually, in my next role, I actually hope it doesn't exist, because that's where the market's going. Because if I'm in that role, I know we're being disruptive, and that's incredibly exciting and incredibly empowering. And, you know, I pointed out, is learning digital so different from the first time you walked into that operating theatre? It can't be that different, because I remember being in that position and seeing, I think it was a coronary bypass procedure. I was like, this is a different world. How can I ever learn all of this stuff? And in reality, you can't, but you can learn a section of it, as we've sort of spoken a bit about earlier. And I think if we look at, I guess, healthcare and how complex that is, we can't solve the problem by all thinking the same ways. You know, if we carry on doing things the same way, why would we hire people to do all things all the same? We just wouldn't. We just bring a robot in, right, to do that one job. So it relies on you as a team of people looking to come into the medical industry to actually find different ways to understand your customers, but find different ways to do things. Because that, for me, in terms of what I look for, is absolutely critical. So I guess if I talk about, you know, digital skills, and I guess, you know, one of the things that I hate, and it's overused, and I'm sorry, guys, you probably use the word talent all the time. I hate that word. I hate it because it assumes that you've just got it. The reality of that is that's not the case. You learn, you become talented, you become skillful, which is a far better word, by learning your skills, by learning how to do something and actually working on your craft every day. Different ways of selling things, learning new technologies. It's all about that. And actually, rather than focusing on what I don't have, I can't be a programmer, or I don't have a digital marketing qualification. It's actually, if you go back and you bring it back to the basics of learning, all you have to do is want to learn. And I think Charlotte and I, and I'm sure it'll be brought up later on, have all both mentioned the same thing around learning from one another, right? Finding out who your different networks are, finding out different people. And I certainly, I guess I look at my role, which is focusing on building healthcare solutions for hospitals, and working at a level where we can sort of look at bigger, more complex solution rather than putting the implant in. It's how can we help a hospital to reduce length of stay? How can we make theatres more efficient and work at that level? I'm looking for a completely different skill set. In fact, I'm looking for people I don't know who could be in the market. I want people to look at things from a different way. And for me, but the fundamental skill has to be that you guys want to learn. It has to be about being enthusiastic, about wanting to learn more. Maybe the future is a medical sales rep will look completely different. I don't know. And you know what? That really excites me. That really excites me. So look, if I look at the future, being comfortable with uncomfortable, that's the piece that always sits out for me. You know, if you're pushing your boundaries, you want to learn more. I've recruited people who, you know, are the people that were so tenacious they would meet me outside the front of the office when I finished work. And it was brilliant because it's a completely different way of doing things. And that was fantastic. I guess what helps you stand out against, say, other people is the ability to take your customers on that journey. You know, we've talked about the digital piece in itself. If you can humanize that process, if you can get your customers comfortable with digital, with robotics, say, with technology, if you can humanize that process, humans are built for connection. And actually, if you can harness that and really work on your customer focus, that is going to help you succeed. And that's what we can do better than anything. And look, rather than focus on, you know, specific qualifications, degrees, like what I would like to know, and I'm sure what other employers would like, is what makes you different from the next person? What makes you an asset? What brings something different to the team? Because that's the most exciting thing you can ever say to anybody who's recruiting for a role. What is it that you bring that is different? And for me, I guess that's that I guess intellectual curiosity, wanting to know more, wanting to understand actually what you can do differently. You know, tell me what I don't know, because if I don't know what I don't know, I'm never going to find out. So that's what I want to see. Anyway, I'll probably talk for far too long, but I will pause there for a couple of questions. And yeah, fire away.
Thank you so much, Will. I think that's just fantastic. And I know none of you knew what each other were talking about. I'm the only one who knows. But you've all talked about, and you just kind of alluded to there, it's really about getting out of your comfort zone, and about learning. And I think about everybody on here who's kind of taking time out to invest in their learning. So it's great that you think in that way. So is there anybody that has a question for Will? Anybody want to type in the box, or you can unmute yourself and ask a question?
I'll ask a question if nobody else is going to jump in. So I'm Casey. I'm also from GemMed, Will, and I think the rest of the team will attest that I'm probably the least tech literate in the group and the most resistant to change when it comes to shifting anything particularly tech related. For those of us that are perhaps a little bit slower to transition to new tech, or a little bit, or even someone who's working with a customer who's perhaps a bit like me, who's a bit slow to adapt, what are your tips for transitioning into a more, I guess, digital future?
That's one of my favorite questions, actually. So I kind of see it in a different way, which is why I try not to go down into like all the intricacies of technology that we build and how we build it, right? I think for your customers, if you focus on the aspects of technology which are of benefit to them, that's going to make them interested. But secondary to that, if you explain anything in a way that is trying to be almost too clever, that's immediately when you lose your customers, right? I talked earlier about humanizing it. I would ask you to sort of reach out, I guess, start with the customers first, and reach out and help them to understand what the technology is trying to achieve. Because then when they can see the goal, they'll want to go onto the journey. To the first point around looking at those technology roles, and I guess this was one of the things that I always push our recruitment teams on, is showing up, and I know you say slow or a bit uncomfortable coming to the party. Show that you're keen to learn a small part of it, and you want to understand that first to then accelerate what it is you actually want to go into. Because you could decide that one element of the technology that you're looking for, whatever that role is absolutely something that you want to do. But there's no harm in asking and saying, actually, this is where I'm comfortable now, but this is where I'd like to go in the future. And anybody who's looking to recruit in tech, it's always a continuous journey. So nobody who is recruiting for tech roles is looking for the finished product straight away, because there isn't a finished product straight away. Who here had a CD player back in the day, right? I thought that was pretty cool, right? I thought that was endgame, right? And now I look at it, I would never, and it used to like change songs and stuff when you're holding it. Whereas now, look at where the technology's gone. But I only understand how to use, say, Spotify or something like that, because I found out how to use a CD player first. So my question is to take it in little steps. Tape player, great, Chris, love it. Back in the day.
That's awesome. Thanks, Will. So there's just a couple of questions I'm seeing pop up in the chat box. One of them is from Maddie. So Maddie's asking, what does the future hold for MedTech jobs? Where do you think the industry is going, and what courses could somebody do to invest in their skills to remain relevant?
Oh, brilliant. So look, I think first and foremost, before I don't completely scare everyone, there will always be a role in some way, shape or form. We don't know what it looks like in terms of supporting our clinicians in some way, whether that's virtually, whether it's in theatre, there'll be different elements of that. If I look at the future of, I guess, for tech, and I guess how that could go, it actually will involve, I guess, the real skill is being comfortable to work and humanize that process for customers, because those are the people that I believe are going to be successful. If we will always have somebody who will manage a person-to-person interaction. It might be over Zoom, that might be different. It might be in theatre, person-to-person. So there will always be a role for that. Again, humanizing that. That's part of it. I guess if I look at the future, I guess, of sales reps as it currently exists, guys, it's exciting. You're going to get brought all sorts of tech from different companies. We're all trying to evolve and do different things. I look at, say, the app space, which we play in. I look at robotics. It's all coming in, and the technology is fantastic. It's brilliant. So I think we will see a rise. We're already seeing a rise in robotics. That's the next step. I think if I look at data and AI, it's how can we use these fantastic tools, say surgical robots, remote monitoring, tracking apps, you know, that's really interesting. And when we think of it as, I guess, what's the job to be done in healthcare, it could be done anywhere. It could be done remotely. And I think that's going to be interesting. In terms of courses, and this is one that I always recommend, it's a personal one, and for me, it's always been useful. A project management qualification is brilliant, because if you learn that, you learn how to not just govern a project, but one of the things that I took from it was actually governing myself, like understanding how I could sort of understand, well, I've got to manage this section, but somebody else has to manage that. That's a really important, really useful thing to do. The one that I did was Prince 2. That's a globally recognized qualification. That's one that I do. In terms of tech courses, that varies. It can be anything and anything and anyone. But just try it, learn anything. I wouldn't recommend that. You know, various different courses on that, because I'll have my own biases, right? So
Thank you, Will. That's great tips. I might give you one more question before we move on. We've got another one in the chat box, which is, I don't know the name of the person. It's not Samsung, but great, inspiring, passionate presentation, Will. What happens when divergent thinkers are ahead of the curve with lack of broader understanding of the team?
So that is a really, that's has certainly been a challenge that I've wrestled with first when I came to Australia. Like I was, if you think about, I guess, you know, core products that we have, and people believing that we will only just sell that product, whereas I believed actually, you know, industry has got a role in supporting a health ecosystem. Like, how can we make that a thing? I think my advice to that is take people on a journey, because if you say this is what's going to happen, they'll say no, it won't, because they've seen the past 20 years have worked out the same way, right? But if you explain to somebody, or you explain a process, and this is one of the things that I explain to our executive board all the time, is let's think about what could happen. And if we invest a bit of time in understanding that, in getting them to understand that, that makes a huge difference. So be comfortable with being a diverse thinker, but also be super aware, of that not everybody is going to be on that journey straight away. So help them, so prove the concept and help them understand the concepts.
Excellent. Thank you so much, Will, for sharing all your insights. I'm sure there'll be a few more questions for you at the end, but I might now move on with our next guest speaker. So I'd like to introduce again Kimberly Russell. Just looking for Kimberly. There we are. So Kimberly is a national sales manager at Boston Scientific. You began your career in the pharmaceutical space, specializing in products such as diabetes, then veterinary pharmaceuticals, before moving into MedTech, where you worked in recon and trauma, and now in a national sales manager position in deep brain stimulation. So I know a lot of our community here will be really interested to hear about your career pathway and moving product portfolios and what that was like. So I'll hand over to you. I'll just stop my screen share.
Tara. I'm going to share and then just double check that everyone can see what they should be seeing. Okay, how are we going there?
Perfect.
Awesome. So first of all, I'll just I'm quite relaxed. I'm very honest. I'm very transparent. I'm more than happy to be vulnerable and tell you when I didn't get things right. So any questions that I ask, I won't put on a facade. What you see is what you get. But Tara obviously gave a little bit of an introduction to who I am. I'd probably like to expand on that a little bit. I am so stuck inside this body who just turned 40 on the weekend. There is still the young woman who had a passion for med devices and medical industry, not just devices, but pharma, etc. Anything medical advances really, or advances. I had no idea what I was doing 16, 17 years ago. All I knew was that I had a passion for this space. And fast forward to now, and I am now in a very fortunate position where I am a national leader for the deep brain stimulation team within neuromodulation for Boston Scientific. And I believe that I'm fortunate enough to be the leader of what I essentially think is the best deep brain stimulation team here in Australia. So I could go on forever and ever as to what my career has, and what has happened in my career, but I'll try and succinctly summarize it while also giving you a bit of a picture. So what you can see here is way back in 2006, I was essentially given an opportunity as a rookie rep in a specialist hybrid role in central nervous system with a Danish pharmaceutical company called Lundbeck. I was with them right through to pretty much 2012. There was some global financial crisis, some major redundancies, and essentially, unfortunately, my time with Lundbeck finished prematurely. I probably would still be there potentially if that hadn't have happened. Moved on to Novo Nordisk, another Danish pharmaceutical company, then decided to move back into a marketing role, but this is a little bit different. So this might look erratic to you, my career adventure, as I've called it, but they actually are quite complementary roles, and I have leveraged my skills that I've learned in each position to move into the next. So with Durox, it was an Australian veterinary pharmaceutical company specialising in anaesthesia, analgesia, and cardiorespiratory drugs. So I was able to go back into a marketing role with that particular company. Then I decided, you know what, I actually want to go back to the human world, which for anyone that's worked in marketing in MedTech or pharmaceutical would probably think I'm crazy, because as we all know, the human industry is regulated quite closely. The veterinary industry is not, so you've got a lot of freedom. So to want to come back into the human devices or human space is a little bit crazy, but I essentially wanted to get back to the human side. So this is where I decided, you know what, it's time to progress from pharmaceutical into devices. So I was very fortunate to be given an opportunity with Smith & Nephew in recon and trauma. I then went on to specialise just in trauma orthopedics. And this is where I'll start to paint the picture, because contrary to what you might think, I am actually going to ask the audience some questions, and I do expect some responses. So if the audience goes crickets, the other presenters have to bail me out and answer this. But I'll paint the picture. Smith & Nephew, whole new portfolio. As William mentioned, learning new spaces is daunting sometimes. So I went into trauma, ended up being quite successful, had fantastic relationships with registrars who are now consultants and still friends of mine, knew my portfolio really well, got runs on the board. I was setting myself up to have a very lucrative chapter ahead with securing tenders, etc. My bonus for that 12 months ahead was going to be nothing short but smashing. Yet I decided, when someone came along and said, hey, there's a job in neuromodulation. Now, just to stop you there, I had no idea at that point what neuromodulation was. Obviously, I did my due diligence, etc., before the interview, but someone came knocking and said, hey, there's this great role in neuromodulation, super exciting space in tech, it's ever evolving, super innovative. Do you want to go for it? Now, I'm in a space where essentially it's like an old pair of socks. I was really comfortable, I was doing really well, and the money was going to be good. Now, my question to you is, would you move? If you had that nice, comfy pair of socks and it was going to be a ripper 12 months ahead, would you move? So I just want to pause for a moment and let people put some comments in the chat. Obviously, there'll be people here with different backgrounds to mine, but knowing what I've just said, does anyone want to put something in the chat, or do the presenters want to, you know, help me out there?
Just answer it.
Yeah, you can answer it. Go for it.
Yeah, I was in a similar position. I wasn't in the previous role for a long time, but I was getting comfortable in that role, selling hospital consumables, and I was hitting up tenders, and I actually moved into this current role that I'm now in imaging technology. So I did make that move. So yes, I would do that because I've done that just like yourself. So if it's something that you're passionate about and you're progressing, and like the other presenters have said, get comfortable being uncomfortable, 100% I should move.
Yeah. Does anyone else want to say whether I was crazy or not? Yeah, most don't grow in the comfortable. Exactly. And look, don't get me wrong, there were a lot of unknowns. I did my due diligence. I figured out what neuromodulation was, probably a good idea before interview process. And you know, it started to excite me somewhat. So my next question is, it was probably redundant. I've moved from ortho to neuromod. It was the best decision I've made. I love the space. Yeah. Good answer. And if you wouldn't move, why wouldn't you move? And look, if I think back to myself, then I was well within my rights to walk away from that opportunity, because I would still be successful. I would have still have kicked goals. So I guess the question is, why did I move? And for me, it was more than just about a role. And this is what I'll talk a bit about now. So you need to decide if it's the right choice for me. And essentially, for me, if you're looking for career progression, you need to look beyond that actual role. So even beyond the role that you're interviewing for, and think, is it the right company for me? Is it the right culture for me? Is it the right environment for me? Depending on what you're trying to achieve. And this is where I sort of ask you, do you know what your values are? And some people do and some people don't. And I will be completely honest and say, probably only in the last 5 years or so could I actually tell you what those were. Now, I pulled this is actually from my CV. It's still 100% relevant. This was from my executive summary. And this was basically me defining my goals and what I was seeking out. So when that role came up in neuromodulation, I wasn't actually looking for a role. I was very comfortable and doing well. But I still had this in my CV. And so highly motivated, dedicated, ensuring both personal and company success. So I would define that as high performing, looking to join a team of goal-orientated professionals. So, you know, collaborative people is another value. Solution focused, again, collaborative, results driven, high performance, and quality without compromising on quality or ethics. So for me, that is really, really important. So the younger version of me, if I had been in the audience on this call, I probably would have screenshot that and thought, hey, that's a really good one. I'm going to include that in my CV. But I cannot encourage you enough to try and define what your values are. So question, and you don't have to put what they are, but I'd be really interested to see if you do know what your own personal values are, and do a thumbs up or a comment in the chat. But more importantly, can you succinctly recall them? So if someone dialed you up and said, look, what's really important to you? What are your values? Can you actually recall them? And this isn't easy to do, especially if you're younger in your career and you haven't had roles within industry. It's actually quite hard to define. So for me, self-awareness is key. That comes sometimes with age, maturity, but I also think you can really get a lot of self-awareness when you put some time in for reflection. You can start, if you don't know what your values are and you think, good God, I don't even know how to start narrowing this down, start thinking about what you don't align with. Think about, it doesn't even have to be companies. It can be in a social situation, the things that you don't feel comfortable with, that you don't think are right up your alley. Then once you can eliminate those that you don't align with, you can start thinking about what drives you to get out of bed in the morning, what makes you, you know, passionate, what, you know, you need to be really honest with yourself. So the reason why I talk about values, and the reason why I talk about that off the back of me making the decision to leave what it was a very successful and comfortable role, is again thinking about beyond the actual role itself. So for me, career progression was important. I wanted to move into leadership eventually at some point. And so when I went through this interview process with Boston Scientific, for me, the standout was the company values. Now, I would definitely work for companies before where the values of the company are on a pull-up banner in HR, and that's about where they go. They don't move further than that. But I've equally worked for companies, and Boston Scientific most certainly is one of them, where those values are genuinely lived and breathed. So I'm going to pop up here. So the company values for Boston Scientific, and this is probably why you can see I had that aha moment through the interview process. So these are all of them. So caring, meaningful innovation, high performance, global collaboration, diversity, and winning spirit. And I can hand on my heart say that everything that was said to me during the interview process about those values is genuinely lived and breathed in I'd say 95% of the individuals working within the company. But I highlighted the ones that were in bold because they matched mine straight off the bat. So if you pull up my little blurb again, high performance, global collaboration, winning spirit, I was like, well, that's me. It's like a match made in heaven. Then you look at the other values and I'm like, yeah, caring. I mean, that's why I want to do this job, is I'm interested in changing people's lives. The innovation piece, I don't think until I worked in, and until I learned more about the neuromod space, I didn't actually realize how innovative MedTech can be. And then the diversity, you know, we've already spoken about that with one of the previous presenters, that that's such an incredibly important space. So all of them, I was like, yeah, okay, it's more than just a role. This is bigger. This is bigger. Challenges, you're going to laugh at this. So I don't know how many of you on the call here have a science or mathematics background. I can tell you that I certainly do not. And my background is definitely business. My background is definitely marketing. So sales, marketing, business, that's where my education lies. So challenges moving into the neuromod role. So you, again, paint the picture, kicking goals, know my portfolio, really onto it. People are looking at me within the team for advice constantly. I was not an expert in my field, but I was certainly one of the more senior for the portfolios that I was looking after. Now, fast forward, I get the role at Boston Scientific. I sit down with the senior field clinical engineer, who I've nicknamed the unicorn. And he says to me, he's like, okay, right, Kimberly, how were you at a year 11 and 12 algebra? And I thought, oh, good God, what have I done? What on earth have I done? Because I can tell you now, year 11 and 12 algebra most certainly was not one of my strong subjects. But, you know, so wrapping my head around the new, and William was talking about, again, learning stuff. You can learn things. This, by hands down, was the most technical space that I've ever had to wrap my head around. Boston Scientific have 90% pass marks, no excuses, it's expected. We work with neurosurgeons. That's absolutely understandable. But you can imagine walking into this space and going, right, okay, this is what I have to get my head around. And needless to say, although challenging, I can tell you now, was it worth it? 110%. Absolutely. I do it time and time again. This space is the most rewarding, most valuable space that I could ever work in. Sure, there's others, but so far I've yet to find someone who can challenge that. So definitely worth moving out of those comfortable pair of socks and into something that scared the living bejesus out of me. So I'll fast forward to what my key learnings have been. So career progression, changing portfolios. Know what your values are. I cannot emphasize that enough. And if you don't know what they are, spend some time investing in yourself to find out what they are, because it's more than just a role that you're going for. It's already been mentioned tonight, Charlotte, in regards to having a group of key mentors. Have your tribe. They're the people you can go to who can give you a completely objective opinion on a situation, unemotional. If you have mentors that you start now with, they will be with you for your whole career and they know you through and through. Assess, is this the right fit for me? And I really believe this, that the interview process is just as much as it is for you as it is for the hiring company. It has to be the right fit for both parties. Find something that interests you. When I do interviews, the poor candidates, they probably think I've drank the Kool-Aid because deep brain stimulation and neuromodulation excites me so much. So find something that interests you. I can't speak for everyone, but I can say that I certainly can't make myself passionate about something, and I'll be open and honest. When I went into diabetes and endocrinology with Novo Nordisk, I thought, oh, I don't know if this interests me, but let me give it a crack. It didn't. I tried. I really did. And it really will be interesting to other people. I totally accept that. But for me, that wasn't for me. And so I learned very quickly, I can't make myself be passionate about something. Sometimes the grass isn't always greener, and that's really important too, because there are so many opportunities out there. And I'm saying, go for it. Don't even think twice. Well, hopefully you don't think that's what I'm saying, but I am saying get outside of your comfort zone. But just remember, the grass isn't always greener. So you need to do your due diligence. You need to know when it's time to walk away and go, you know what, maybe this opportunity isn't for me. It's not the right time, or there's just a few things that don't seem right. It's okay. It's okay to walk away from opportunities. And remember, it's not just about the role. I've said that multiple times. What else can the company offer you? I'm very fortunate at Boston Scientific. Yes, I put the hard yards in as a territory manager, moved into a field sales manager role, and now I'm national sales manager. But I did my time. I did my time in the field. I showed my value. I got runs on the board, and then I was given the opportunity for development and leadership training. So they're my key learnings. So feel free to screenshot that one if you want. But I believe it's on the recording, so you can go back. And this is where the slides align shortly. Actually, sorry, bring it all together. So again, just remembering that role that was super comfortable, I was doing really well in, didn't even know what neuromodulation was, is the best thing that's probably happened in my career. So yeah, very fortunate, so glad I did it. This is the same slide as Charlotte had, and this is why Tara told us as the presenters there was some overlap. Get outside of your comfort zone. It's where the magic happens. You know, I turned 40 on Saturday, so I can say I'm old and wise now. But genuinely, that applies to any stage of life. Definitely jump out of your comfort zone. You won't regret it. Yeah, that's me.
Thank you so much, Kimberly. Such a great presentation. And again, thank you for sharing, you know, all of the concerns. And like you say, it might seem crazy to some people to jump at that point, but it was not everything was being aligned for you. And I think for you to kind of take that leap and, like you say, step outside your comfort zone, but with good advice and making that educated decision along the way, it's really, really worked out for you. And clearly there's great alignment between your values and the company values that have enabled you to really flourish there. So any questions for anybody for Kimberly? Particularly, I know we do talk to a lot of people all the time, and it might not always be the forum for that sort of question, but just about that changing therapeutic area or changing portfolio. And certainly we have had a couple of people ask about changing portfolio to then step into a management position. Is that possible? Which clearly it is. So any specific questions for Kimberly? Just reading back in the chat.
Hello, yeah, I have a question.
Hi, Preston.
Hello, thank you so much for that. That was a really amazing talk. I wanted to know, so when you're changing therapeutic areas, how do you know that you're going to be able to do it? And secondly, how are you able to kind of convey that message in your interviews as well?
Yeah, so I got the first part of the question. Just to clarify the second part. So you mean as a candidate, how you relay that? Is that what you're saying? That you have the potential to be able to do it?
Yeah.
Yeah. I think, first of all, how do you know if you're going to be able to do it? Look, I'm yet to meet an individual that can't eventually grasp their head around something. I mean, don't get me wrong. There's certainly areas in MedTech where you definitely need to have strong technical aptitude. I think that is helpful. But heck, again, I'll be vulnerable. I'll be honest. I was the person in high school and university that had to pedal 3 times harder than the next person because sometimes things just didn't stick first time round. And I do not have an engineering, science background, mathematics at all. And I would say to you, if I can learn neuromod, then you guys can learn anything. Trust me, it's a hilarious journey. But yeah, look, I work with field clinical engineers that have biomed engineering backgrounds. I've got osteopaths on my team. I've got researchers that are on my team. I've got such a diverse background. I think you can learn anything. I really do. And William, I know that seems to be something you're quite passionate about as well. But I think if you are tenacious enough and you are passionate enough about something, you will get there. So that's to answer your first part of the question. Second part of the question regards how do you relay that in the interview? Yeah, I think that comes down to transferable skills. You know, at the end of the day, if someone had given me Ohm's law, which to some people who know electrical engineering is 101, but for me, Ohm's law was like, blow my mind. If someone had given that through an interview process to me, I probably would have struggled, but I leveraged my transferable skills. And I think if you, again, have some sort of basic technical aptitude, you can grasp your head around anything and lean on those other things that you can bring to the table. Because I can tell you now, they certainly didn't hire me for their algebra skills.
Kimberly, we've just got a question here from Josh. Thanks for that question. Josh saying, obviously there was a kind of a steep learning curve. So how did you, what was actually your method to learn these really complex technical bits of information?
For sure. It's actually a really valid question because one of the things you should always ask through an interview process is what the training looks like. What does the training look like? What does the support look like? And essentially Boston Scientific, I was told this through my interview and I tell my candidates coming into my team this as well. The information, the support, the everything you need to get you across the line is there, but it's up to the individual to put the hard work in to get there. So I think as long as you can walk into a space where there is good support, there is good training, and you are prepared to do the hard work, you will get there. I was very fortunate at Boston Scientific. The unicorn I referred to earlier, one of our senior field clinical engineers, he is incredibly intelligent. He's incredibly good at teaching, but Boston Scientific have a very rigorous training program as well. To give you an idea, to be autonomous in deep brain stimulation, it's a minimum of 6 months training of 90% pass marks and quite rigorous exams and study, etc., to be able to even get to the point to be able to do something solo. So it is quite full on, but all the support and all the training is there. But, you know, then there's other things. Some people learn via YouTube, and don't get me wrong, there is a great YouTube channel called 2 Minute Neurosciences. That one helped me quite a lot as well. So there's a lot of resources out there. Just be, you know, do what works for you. Some people learn via video versus reading. Dr. Google, 100%. It's just being resourceful and tenacious.
Brilliant. Such great advice, Kimberly. Thank you so much. Now, sure, we could keep talking about this topic, but I'm going to move on because we've got about 15 minutes left, and I think Jared's presentation might be a little bit longer and some questions. So hopefully everyone can hang around, and I will hand over to Jared. So just 1 second. So I'll just introduce Jared. So hi, Jared. Jared's Business Unit Director of Sports Med at Medacta. Again, not everybody was meant to be an allied health professional, and Kimberly, you weren't. So we've got a bit of a mix of people on the call, but Jared also started his career in physio before moving into a clinical specialist position. And over the last 11 years has very specifically built up his commercial and business acumen, leadership skills to be in this position today. So I'll hand over to you, Jared, to share your career journey.
Thanks, Tara. I'll just share my screen. Can you see that okay?
Yes, that's great.
Okay, perfect. Well, they've been some really impressive presentations, so I'll do my best to try and keep up. But Tara's asked me to talk a little bit about being horrible and desirable, and I guess what that means. She said talk a little bit about your career, so I'll talk a bit about myself and how I got to where I am, and basically just some thoughts around how to be, I guess, hireable or desirable to any manager that you're interviewing for. A couple of points down the bottom. These are strictly my opinions and personal experiences only. There is absolutely no research or fact going into this. It's just my experience. And please ask questions. I know Tara said wait till the end, but if you've got something that you want to ask about anything I say, just interrupt me. This is a safe place. So my name's Jared. I'm the Director of Sports Medicine and Extremities at Medacta. Like many of you, I have a vocational background. I graduated as a physiotherapist in 2007. And like many of you, I have a vocational background that I probably didn't want to do at the time. So I entered medical devices in 2012 as a clinical specialist at Johnson & Johnson. I thought it was the coolest thing ever. It was a job I didn't even know existed until I was into it. There was a lot of learning, a lot of new experiences, a lot of behind the scenes of an operating theatre. And to say I had a honeymoon period for about 3 years. I transitioned from a clinical into sales. I met new people, learned my sales craft, hit numbers. Everything was really exciting. But then I realized I wanted more. I was really passionate about change. I was looking about how I could implement different efficiencies into my territories to try and do something a bit different than the same thing I did that prior year, but just with 6 or 7% more the following year. I realized I became really curious about how we can do things differently, how are they doing things differently in other states, other companies, other countries even. And then I decided that I'd embrace that drive and that enthusiasm I had for really progressing myself professionally and personally. I decided I wanted a seat at the table. I wanted to be a general manager, a managing director, or a director. My first realization is that these roles takes a significant amount of skill and experience, and I had neither. I realized that I needed some form of sales experience, which then led into sales management, a little bit of marketing experience. I needed to understand business operations, the logistics side of it, and then the financials, and really control a P&L. I worked out that was probably the logical step, but I wanted to be different again. So I really want to differentiate myself. How was I going to transition sales management into a leadership? How was I going to work in different markets? How was I going to get experience understanding different business models? So I was open to moving through different companies at that time to try and really, space out my skill set. So in 2015, 3 years after I'd started, there was an opportunity for me to help build an orthopedic division at a company called Life Healthcare. I was a senior territory manager, so it was just a straight transition across from what I was doing into another role, but that led into state management. So there was an idea there that I had a slight career progression. For those of you that don't know Life Healthcare, it's a large-scale distributor. So basically, I got to work on my business acumen as a direct, so I had heads underneath me, but I also got to work with distributors. So I got to understand what a relationship looked like on a business-to-business level. There was an opportunity for growth and expansion, both personally and professionally. So I grew a team underneath me. I built a business. I managed to grow the dollar value, but I also got to learn on the way, which was going to build that skill set for my next role. It's been mentioned a lot, but it's important to know who you're going to be working for and what skills they offer you and what it is that person has done in the past and is going to teach you through your journey at that company. So I was lucky enough to have a very impressive general manager who I reported into, and then the CEO of the company I thought was someone that I wanted to base my career off, and had done a pretty good job of setting a blueprint of how to achieve that level. Most importantly, it was different. So I was at Johnson & Johnson, and that's a great company. It's a big company. It's very consistent. It's got its structures in place. It's a very well-oiled machine. The polar opposite is a startup company trying to bring orthopedic instruments, implants into Australia and then sell it through a distributor model. So it was different enough for me to get those different experiences. I packed the wife up, I packed up the dog, and we were off to Melbourne. 4 years into that role, I took a bit of a career pulse check. I had managed to grow the dollar value of the company or the division that I was looking after. I had increased a range of my management experiences. So again, I had direct heads, I was working with distributors. We were bringing products into Australia. So I got that marketing aspect of understanding a strategy, business planning. I got to forecast what kits I was going to need, what sales I was going to make, and then therefore what stock I needed to hold within the warehouse. A distributor model, we got to talk about landing costs, how much we're going to get them for, what our profit looks like, and that set back the basic profit and loss and margins. So for those of you that don't have much experience in profit and loss, basically if you can sell it for more than you bought it from, you're making a profit, and that's business. I got to increase my footprint. So although I started in Victoria, I looked at managing Tasmania, then South Australia, New South Wales. So I got to increase my exposure within the country and my understanding of how the different markets work and how I can influence different points within different markets. Most importantly, over those 4 years, I really worked out what I wasn't going to be taught. In that time, Life Healthcare went from being privately owned to publicly owned, and I didn't really know what an IPO was. I didn't understand the financials. I didn't understand the accounting side of it. So I realized that I could probably fill the majority of those gaps studying an MBA. And at that time, I could use the skills that I was learning within that course to then apply them to the job that I was doing at that time. And the skills that I learned that I couldn't apply, they were just interesting to learn anyway. I put them down towards what my next role might look like. A couple of years into that, one of the gaps that I had was some serious people management. I'd never really looked after a team bigger than 4 or 5 directs and then 4 or 5 distributors. So a role came up at Smith & Nephew where I transitioned into an area sales manager. The team there was, I think, 14 or 15, so I got that management experience. I was also lucky enough to be involved in the integration from them being a distributor in Victoria across into going under the direct umbrella. So if you can imagine, that involved a lot of cultural shifts, a lot of processing shifts, a lot of understanding that the Smith & Nephew umbrella isn't the bad guy. They can actually provide us with a lot more money to do a lot more cool things and make a lot more money as sales reps. What I hadn't anticipated is COVID. So in Victoria, where I'm based, it was pretty relentless what we had to go through. So my high-performing sales staff ended up being virtual sales force, and we spent a lot of time working on skills that were going to be applicable when we go back out in the workforce. But I think the first year was more understanding technology than learning anything about sales. But it was a point in time where we all had to, pivot in what we did and how we learned, but to still stay active and ensure that we were providing outcomes for the company. So in 2022, the start of this year, I realized that I'd achieved my skills and experience goals. I'd transitioned from sales management into leadership. So I'd managed to take people on the journey with me. It's been said a lot tonight, but influencing without authority. And for me, that means that people want to be on that same bus as you. They want to be doing things with you because they understand what you're doing, why you're doing it, and what you see the outcomes being. And that's, for me, a form of leadership. The successful growth, both in a dollar value and team expansion. I'd increased my business acumen over the past 6 or 7 years to a point where I really understood what was happening from a business point of view. I could introduce a strategy and execute on it. I'd identified my gaps, so as I mentioned before, an initial public offering, finance and accounting, and I managed to fill majority of those through my MBA or external learnings. And that's what brought me to my current role. So some of the challenges or observations that I made in my time, I think there's a big point around tenure. For me, it's really important to be able to speak to your experience versus the time that you've done in a role. I mean, you might do the same thing over a 4-year period and that could be seen as tenure. For me, it's being able to do things in that period that really show that you're progressing as a person and that you're progressing as a professional. 4 years doing the same thing but achieving 10% more each year means you're really good at achieving 10% each year. It doesn't mean that you're necessarily going to be growing as that person or professional that's going to make you available for the next role. Having said that, if you're only in a role for a short time, 1 or 2 years, and there's this misconception that can be seen as negative, it's really not. If you can talk to the experience that you've done in those 2 years, why you've done it, where you've gone, and how you've grown from those experiences, then it's just as valuable as a longer tenure. I think identifying opportunity is a challenge. I almost encourage you to reverse engineer your thought process and have a look at the skill sets that you currently have and what role suits your skill sets, as opposed to looking at what your next defined career progression is and how do you achieve those skill sets. So really broaden your mindset. It's okay to go and do something different. You don't have to sell orthopedics through your entire career. The longer you're in your role and the more skills you develop, those skills are then transferable into other companies. I was lucky to be able to move interstate. It was at that point in time in my life where that was okay. And I understand that for a lot of people, getting that market understanding of different states is harder. But I think what COVID's taught us is you can work remotely from different states, a lot of virtual learning, and you don't actually have to be in that market to have any control over that market. If you hire well and you have people down there that are skilled to a level where they understand and they're on that journey with you, then it makes it very easy to work in a different state from where you have majority of your business. So this slide deck that I used had a slide for a quote. So I put one in. So this is from me, and it's been touched on tonight already, but every interaction is an interview. You'll never know who your next boss is going to be. It could be the person standing next to you in the theatre. You never know if they're sitting in the tea room watching how you act, and you never know whether your next boss is going to reach out to one of your surgeons to get a reference from them on how you conduct yourself. So my advice would be to always be authentic and always be true to your personal brand. You really want to work on being the best version of yourself within every interaction. The longer you're in this industry, the longer you're in MedTech, the smaller it gets. You'll find that no matter where you are in Australia, there's someone in a different state that's either worked with you or knows someone that's worked with you, and it can become quite small. So that would be my quote and my advice. As far as progressing your career, I would advise that you really understand where you want to be and what you want to do to get there and how you achieve what you need to do to get there. So have a goal-focused approach. Understand what the plan is. Make it 5 years, but make it fluid. I need to get this amount of skills. I can get that from this role, and then I can transition. Always look for opportunities. They're not just going to appear because you decide that you want to take a different role on. Always keep your mind open, always look for opportunities, and define your own version of progression. There's this misconceived perception that a career progression in this environment is clinical to sales, sales to senior sales management. It doesn't have to be that way. If there's a set of skills that require a title sideways step, then it's okay to go that way. It's okay to get that set of skills which is going to take you to your next role. It doesn't always have to be seen as a sideways step. And if it's a progression in your skill set, then it is a career progression. Find a mentor. That's also been explained tonight a few times. For me, a mentor isn't someone that you can touch base with every week. It's someone that's already set the path for you. Technology these days, you can jump on LinkedIn and basically see everyone's life and their career. You can follow them, understand where they're going. Like I said before, the CEO of Life Healthcare, he was a CEO at 43, and I thought that was pretty cool. So 6 or 7 years ago, I thought, yep, that's something that is achievable. It might not be attainable, but why not set your standards high? I thought that, yep, what do I need to do to be the CEO at 43? And then worked out my steps that way. I also wasn't afraid to reach out to that person on LinkedIn. It's okay to reach out to people that have done something and that you want to replicate, and just ask them, I saw that you've done this. Do you mind giving me some advice on how you got there? Or what were the biggest steps or the biggest barriers to the steps that you made? You'll find that most people are pretty open to chatting about the things they've done and how they've achieved it. My key is to always develop everything. So continuously learn. Don't become complacent. Ask yourself, and again, it's a common theme tonight, but does your company offer any internal upskilling? Do they offer to pay for any of your external upskilling? Are they investing into you as much as you're investing into them as a company? Are you developing from a professional and a personal point of view? It's okay to really focus on your personal or your professional life, but are you giving back to your personal life as well? For me, work is a balance. It doesn't just have to be all work. It's a balance between making sure you're getting that personal achievement, that personal satisfaction, just as much as you are from your professional satisfaction. So I really encourage you to just maybe take a step back and have a look at what your company offers and whether you've invested into yourself as well in the last couple of years. So from my dodgy model on the left of a pyramid, you get the understanding that the higher up you go within an industry, the less opportunities there are. So they become sparse, they become few and far between. So how are you going to differentiate yourself? How are you going to stand apart from the other people going for those roles? And again, I really encourage you to build out your skill set. So really understand what your current role is and understand what the next role is that you're going to try and do. And if there's a chance that you want to stay within your company, then just be the logical choice for when that role opens up. If you're a territory manager looking to be a regional sales manager, do you have a broad understanding of what the other territories within that region are doing? Do you understand the numbers? Have you asked if you can sit in on a meeting and just get up to speed with what they look like? Have you done all the internal training that you require? Have you got the leadership skills? Have you exhausted everything you possibly could so that when that role becomes available, they say, let's put him or her in the role because that's going to save us a lot more time trying to school someone on how to do that role. You can just step straight in there. And I can assure you it's a lot easier for a manager to hire someone that's going to hit the ground running than think about the time they need to invest to get that person up to speed and then take on the role. So be the logical choice. In the same breath, it's okay to move. It's okay to leave the company. Be ready for that next step. Continue to upskill, continue to want to be that regional sales manager. So when that role does open up at another company, you can apply for it and you can take that next career step. The manager, your manager should be okay with it because they've done their job. They've brought you in, they've built your skill set to a point where you now are better than the role offers and you want to progress, and that's okay. Your manager should be really happy for you. Don't expect the next progression. Don't just expect because you're a sales rep, you're magically going to step into a regional sales manager role. We all know those gun sales reps who 120% year on year, they're really good at what they do. But a lot of them aren't going to make good sales managers, and a lot of them aren't going to make good marketing managers because they're so focused on making that sale. So if it's what you want to do, if you want to progress, make sure you continue to build out that skill set. Understand the next role you want to go in. Every role is different. Know what they are and how are you going to get them. The key for the next step is your preparation. So what are your motivators? Are you leaving your current role because you don't like it and therefore you're taking anything? Or are you wanting to take the next step? And there is a big difference. I mean, at every point in time, someone gets the shits with what they're doing and they want a new role. But is that really the right motivator? And are you making the right choice for your career? Or are you going to think what it is you want to do and then build out that skill set so when that role does become available, you can then step into it. When you do find the role, really understand the role you're applying for. What type of skill sets are they looking for? Who's the hiring manager? What experience does the hiring manager have? What experience is required for the role? What's the current culture? Are you a culture fit? When you submit your resume, tailor your resume for the role that you want. If you have decided that it's a sales role that you want and you apply for 5 sales roles at 5 different companies, you should be sending 5 separate resumes because your resume should be tailored to that company you're applying for, having understood what their pillars are, what their culture is, what their background is, what their drive is, what their motto is. You want to position your resume to stand out from the rest of them and really understand. You want to be the best candidate for that role. When it comes time to sit down and have that interview, it is impossible to over-prepare. Reach out to your hiring manager and find out from them what the role entails. Make sure that you've had that conversation with them, if possible. It might be HR, but just really understand what the role is. So when you go down and sit down with them, you already know what it is that they're likely going to ask you based on your experience and based on what their lookouts are for you. Understand the company. So again, what are their values? What differentiates the company? Are they a distributor? Are they a direct company? Are they focused on patient-specific outcomes? Are they focused on mass production of hip replacements? What is it about them that gets them going? And understand the direction of the division. Do they want you to come in and get 10% year on year, or do they want you to come in and blow the competition away with new technology that's going to allow them to put a bionic arm in? Put together a plan. It doesn't matter if you're going for the national sales manager role, the director's role, or you're going to try and apply for a clinical role. Always have a plan. You will stand out from 95% of the candidates. Even if it's a 30, 60, 90-day plan, if you're going for a marketing role, put together a go-to strategy plan for an implant that already exists, but just have a plan. I can assure you it'll set you out from the rest. Present well, so speak to your experiences. A hiring manager wants to hear about why you want to be at the company, not how bad your current company is and why you want to leave. So really talk to your experiences, speak to the role you're applying for, tell the hiring manager what it is that you're going to bring and how you're going to get there and how you're going to work together and what the next 12 months looks like. Now, I'll put the last point in green because it is paramount, and show initiative. So what gap did you discover? How did you identify it? And how did you address it? If you're currently working in the logistics chain and you found a way to be more efficient with the processes down there, and then you tried to implement it and you did it this way, even though they didn't want to put it into their current business, this is what your outcomes would have been. That initiative is paramount. And again, you'll find that 95% of the hiring managers are looking for initiative. How can they come in, learn by themselves? How can they get up to speed quickly? And how can they go and do their role without me having to check on them day in, day out? And finally, invest in yourself. There's nothing more important than investing in yourself. Your personal brand is the one thing that you don't need any experience to invest in, and you've got complete control over. So be the best version of yourself, constantly learn, constantly invest in yourself, and don't be afraid to talk to how you've invested into yourself. So finally, I guess how to be hireable, have a plan, truly understand your worth, understand how you can develop personally and professionally, and don't be afraid to talk about that in an interview or to anyone that's a potential hiring manager. Be desirable by differentiating yourself. What is it that you've shown initiative in? How have you created a plan that's going to set you apart from the rest? Prepare really well, and again, I can't overemphasize it, show initiative. So thank you, and again, feel free to ask any questions or reach out if you need to. You're on mute, Tara.
I've got a tip for you, take your mute off. No, I know we're running over, but I know a few people have questions for Jared. So thank you so much. Such a great talk, sharing all your insights from your career journey. Does anybody have any questions for Jared? So we did have one whilst you were talking, which is, what was your motivation for wanting to move into a business unit director position?
My motivation?
Yeah.
Again, I wanted to be in a position where I could influence change. I could implement change and I could influence the direction of people either within the company or below me. So my passion is building business, and I understood very early that that could be selling cars, it could be selling computers, it could be selling pens, it could be any industry. It just so happens that orthopedics is my vehicle. So once I got a grasp of that, I guess I kind of went on the journey and worked out the direction I wanted to go in and how I was going to get there.
Excellent, thank you, Jared. Any other questions for Jared or for anybody else on the presentation panel today?
Hi, yes, my name's Kevin. I just got a question about, because there's been a lot of discussion about moving from one area of medtech, such as from clinical to sales.
Yeah.
But just for this step before that, because I'm currently a physiotherapist, and just how to get from the physio into the medtech industry, what would your advice be for applying for the right job? Would you be applying for like a medical device jobs that aren't specifically in your clinical area of expertise or interest, just to get your foot in the door, grab the opportunity, grow and learn from there, or wait around for a medtech job in the area of your interest first and then grow and develop from that?
Are you asking one of us from GenMed, Kevin, or would you like to ask one of the guest speakers who's come from a physio background?
I think more from anyone that's done from physio background. So
Yeah.
Yep.
So maybe Charlotte or Jared.
Yeah, I'm definitely happy to kind of answer this one, and maybe
Thanks,
Jared
Charlotte.
can jump in after. But I mean, the easy transition really is from something that you already know. And I think as a physio, you're very hireable if you're kind of coming into orthopedics or sports med or trauma. I think that's the, excuse me, the logical step. It's not to say that you don't have transferable skills in something else. But for me, my experience trying to get into MedTech, it was really difficult. And I really had to have someone that sort of took a chance on me. But in saying that, we're always looking for talent. So, you know, I'm not sure if I'm really answering the question that well, but my advice, do what you know to begin with, but don't close all the doors.
Thank you, Charlotte. Awesome. And now somebody else has got a question, Rach. So how valuable anybody who's completed their MBA from the guest speakers, have you found that been to your career progression? I know, Jared, you spoke about that filling some of the gaps, financial gaps.
Sorry, I'm back. You would have thought a year of COVID, I would have learned how to make sure my computer's charged. Classic. Sorry, there was my computer cut out halfway through a question.
That's okay. The question was how valuable have you found completing your MBA to your career progression? I know you mentioned it helped with some of the gaps you had.
Yeah. Look, I'll tell you some truths about MBAs. They are an amazing tool to utilize if you can. It's just as important what MBA you do than just getting an MBA. You'll find that you can do a couple in 12 months that will probably teach you very little and cost you a lot of money. But if you can find one that will allow you to be flexible, the one that I did a bit of mine at UQ and then the rest of mine at Deakin, it allowed me to do recorded sessions, so I could watch them at night time and then do the online exams, and I found it incredibly rewarding. For things, I mean, there's a lot in this industry that they won't teach you, and in particular, the finance and accounting subjects are really important if you want to get to a level within your career that allows you to have an influence on those. Unless you've got someone in that area who's going to sit down with you and explain what it means to launch a company into initial public offering and what the share prices are and why they're set at that price and how we can increase our margin revenue by 2% a year on, unless there's someone that's going to talk to you about that, I highly recommend you do some external education.
Thank you, Jared.
Yes, very.
Okay. Sasha, I think you've got your hand up.
Yeah, thank you. Just want to say thank you all. I suppose this question goes out to all of the presenters tonight. I think everyone spoke to skill sets. I was sort of wondering, what key skills do you think you've developed throughout your career that you didn't expect to gain, but that has impacted where you are now?
Thank you, Sasha. Maybe I'll go to Kimberly first. Is that okay, Kimberly?
Yeah, for sure. It's a really interesting question. It's a very poignant question. But to think back and articulate things that I didn't expect that I would gain, I'd have to be honest, I'd have to really think about it. I think that probably this isn't answering your question directly, but one thing I've learned that, I mean, if you had have asked me at the very beginning of my career, because I didn't even talk to anyone about what I did before I came into the medical world. So I didn't start there out of school, and it wasn't something, if you had have asked me, is this where I would be now? Would I be in a leadership position now? I would never have necessarily thought that that was something that I, the 18-year-old version of me wouldn't have forecast this is what I am doing now. I guess I have learnt through trial and experience things that I have, I guess, that I'm passionate about and I have a gift for, but I've worked hard to develop those areas. Leadership is definitely one of them. Communication skills, I think, every role you go into, you're going to develop better communication skills. Technical aptitude, I mean, if you want to refer back to my presentation, That is not an area I thought that you would see me in, but yet here I am, you know, working with neurosurgeons in a highly technical area. For me, it's probably the more technical space and wrapping my head around the very intricate details of electrical engineering and so forth. That's not something I ever thought I'd be doing. But yeah, I guess it's not answering it succinctly, but through a process of elimination and being exposed to different roles, I found out what I enjoy, what I probably naturally am gravitating towards, and then sort of running towards those opportunities. So it didn't really answer it as perfectly as what I would have liked, but hopefully that gives you something.
I'm happy to take that.
Yeah.
For me, it's the ability to harness lots of different people with different skill sets and ways of doing different things to achieve the same goal, right? I think Jared talked slightly to this as well, is having an ability to have, you know, different people with different ways of trying to achieve things to get to the same overall goal. I think that's a skill that I really learned, and that comes through different levels as a rep, leading the innovation team in the UK and doing what I do now. Is, you know, be that indirectly managing or working as a team with lots of different business units, lots of different functions. That's something that you learn and is incredibly useful. You know, every interaction counts, right? And that includes internally within the business that you work in.
Thank you. Well,
add to that. It's a really good point, William. That's probably the one thing I've learned as well, is that you can't be the expert at everything. You absolutely cannot. If I didn't have the team of people that I had around me, we wouldn't have the success that we've had in the market. 100%, everyone has different skill sets and different strengths and so forth. And individually, you might have a whole heap of high achievers, but you still won't achieve anywhere near as much as what you can when you collectively work together. That's why I hire all the people I do, because some of them are far smarter than I am, but also we all have different skill sets. Yeah, so that's a really good point, William.
Thank you. Charlotte, look, I'm aware that we are well over time, so if anybody does need to leave, there will be a recording of this, and I won't keep our lovely guest speakers too much longer, but maybe we'll just finish with Charlotte and Jared quickly answering Sasha's question.
Yeah, thank you. And Sasha, it's so nice to see you on the call. For anyone that doesn't know Sasha, she's an absolute superstar. So very lucky to have her in the team. But I'd say for me, I come from a physio background. So for me, anything business-wise was something new. So, you know, P&L, forecasting, interviewing, all of that was, you know, probably the biggest things that I sort of had to learn. Even if I go all the way back to my high school, like when I look at the subjects I did math, science, PE, and English. There was no business even in that. So it's kind of amazing what you can learn if you really sort of set your mind to something.
Thank you, Charlotte. And Jared?
This is about what I learned on my journey, right? What I didn't expect to learn.
Yeah.
Look, I think firstly, you don't really know what you don't know. So there was a lot of learnings about stuff I wouldn't have predicted would come into effect. I think my biggest learning is that to manage difficult people in difficult situations, you know, not everyone, everyone's different, right? So there's always going to be different ways to resolve different outcomes, and it's really about understanding how you're going to work with somebody to resolve that outcome in the most mutually beneficial way. So I think my biggest learning is how to manage difficult situations, whether it's personnel or stock or professional, whatever that might look like. In the early days, I thought everyone was just going to be cool and do their job, but time would prove that that's not the case.
Thank you, Jared. Thank you, everybody who's joined us tonight. I'm sure we could keep going. If you do have any more questions, feel free to email them and I can share them with the guest speakers and share the answers. Again, I want to thank you to our guest speakers tonight for giving up their time, and to all of you who absolutely invest in your learning and want to keep coming and upskilling, and we'll keep you abreast of anything that's happening next year. But enjoy the rest of the year. Thanks to everyone and have a good evening. Sleep well. Bye. Right, thumbs up.
Do you want to stop the recording, Tara?
Yes, so can you do that? I'm just going to remove these two.